What if a heart attack doesn't always look like the dramatic, clutch-your-chest moment shown in movies, and some of the most dangerous cardiac events after 50 present through symptoms so subtle, so easy to explain away, that many people miss them entirely until it's genuinely too late to act quickly? This is one of the more important, potentially life-saving topics we'll cover, because silent or atypical heart attack symptoms are genuinely common, particularly in women, people managing diabetes, and adults over 50 more broadly, and the gap between recognizing these symptoms and getting appropriate emergency care can make a meaningful, measurable difference in outcomes. So today we're going to walk through 7 specific signs of a heart attack that are frequently missed or dismissed, why each one gets so commonly overlooked, and exactly what to do if you or someone you love experiences any of them. Before we begin, this is important. If you are currently experiencing any of the symptoms described in this video, please call emergency services immediately rather than continuing to watch, searching for more information, or waiting to see if symptoms pass on their own. This video is for education and awareness, not for diagnosing yourself or others in the moment, and the guidance throughout is clear on this point. When in doubt, seek emergency care right away. Now let's begin. Most people believe a heart attack announces itself clearly: sudden, severe chest pain, unmistakable and impossible to miss. And sometimes it does present exactly that way. But research on heart attack presentations, particularly in women and older adults, has consistently found that a meaningful percentage of cardiac events present with symptoms that are subtler, more diffuse, or located somewhere other than the classic center chest pain most people associate with cardiac emergencies. Understanding these less obvious presentations isn't about causing anxiety over every ache or unusual sensation. It's about recognizing a genuine pattern of symptoms worth taking seriously, particularly when they occur together, appear suddenly, or happen in someone with known cardiovascular risk factors. Here is why these atypical presentations become particularly relevant to understand after 50 specifically. Cardiovascular disease risk increases substantially during this decade and beyond, meaning the population most likely to actually experience a cardiac event is precisely the population that benefits most from recognizing these less obvious warning signs. Additionally, some research suggests that pain perception and symptom presentation can shift somewhat with age, and conditions like diabetes, which become more common after 50, can specifically blunt typical pain signals through nerve-related changes, making atypical presentations, rather than classic chest pain, considerably more likely in certain individuals within this population. Let's start with the first commonly missed sign: unusual fatigue that feels genuinely disproportionate to your recent activity level, sometimes described as a profound, unfamiliar exhaustion that comes on over hours or a few days rather than gradually over weeks. This particular sign is especially common and especially frequently dismissed in women specifically, who research shows are more likely to experience fatigue as a prominent heart attack symptom compared to men. This fatigue often gets attributed to simply not sleeping well, being under the weather, or just having a busy stretch, precisely because it doesn't feel dramatic or alarming on its own. What makes this fatigue worth taking seriously is its sudden, unusual quality, distinctly different from your normal tiredness, particularly when it appears alongside any of the other signs discussed throughout this video. The second commonly missed sign involves shortness of breath that occurs without the chest pain most people expect to accompany it, sometimes appearing during activities that wouldn't normally leave you breathless, or even at rest. This can be easily attributed to being out of shape, a respiratory issue, or simply getting older, especially when it isn't accompanied by the classic chest pain narrative most people are watching for. Shortness of breath without an obvious respiratory explanation, particularly when it's new, sudden, or occurring alongside other symptoms discussed today, deserves genuine attention rather than assumption that it reflects general deconditioning or a minor respiratory bug. The third commonly missed sign involves discomfort in the jaw, neck, or upper back, rather than the chest specifically, a presentation that's genuinely common but rarely what people are watching for when they think about heart attack warning signs. This discomfort is sometimes described as an aching, pressure-like, or squeezing sensation rather than sharp pain, and because it's located away from the chest, it's frequently mistaken for a dental issue, a pinched nerve, or simple muscle tension, especially if it appears without any classic chest symptoms accompanying it. The fourth commonly missed sign involves nausea, indigestion, or a sensation often described as heartburn, particularly common in women and frequently misattributed to something eaten recently, especially when it occurs without any chest discomfort. This particular symptom is especially prone to being dismissed or self-treated with an antacid, since it genuinely mimics ordinary digestive discomfort, making it one of the more commonly overlooked signs specifically because it feels so unremarkable and so easily explained by an everyday cause. The fifth commonly missed sign involves breaking out into a cold sweat that isn't explained by heat, exertion, or fever, sometimes described as a sudden, clammy sensation that comes on unexpectedly. This is often dismissed as anxiety, a hot flash, or simply feeling unwell in a vague, general sense, particularly when it isn't accompanied by chest pain specifically, even though this symptom, especially when it appears suddenly and alongside any other signs discussed today, reflects a genuine, well-documented cardiac warning sign worth taking seriously. The sixth commonly missed sign involves lightheadedness or a sensation of dizziness, sometimes accompanied by a feeling that you might faint, particularly when this occurs suddenly and without an obvious explanation like standing up too quickly, a pattern discussed in other conversations about orthostatic changes. This symptom is easily attributed to dehydration, low blood sugar, or simply standing up too fast, especially in older adults who may already experience occasional dizziness for other, more benign reasons, making it genuinely easy to dismiss a cardiac-related episode as one of these more common, less urgent explanations. Now let's talk about the seventh and final commonly missed sign, and this one involves anxiety or a specific, overwhelming sense of impending doom, a genuinely well-documented symptom some people experience during a cardiac event, described by many survivors as an intense, unexplained feeling that something is seriously wrong, distinct from ordinary worry or stress. This particular symptom is especially likely to be dismissed, both by the person experiencing it and sometimes even by others around them, since anxiety is such a common, everyday experience that its connection to a genuine cardiac emergency isn't something most people would immediately consider, particularly if it isn't accompanied by more classically recognized physical symptoms. Now, before we go further, let's address a few important points about how to think about these 7 signs specifically. It's worth being clear that experiencing any single one of these symptoms in isolation doesn't necessarily mean you're having a heart attack, since each of these signs, individually, can also reflect many considerably more common, benign causes. However, several important factors should raise your level of concern and prompt you to seek emergency care rather than waiting to see what happens. These symptoms appearing suddenly, rather than gradually over an extended period, is one significant factor. Multiple symptoms from this list occurring together, rather than a single isolated symptom, is another significant factor. And having known cardiovascular risk factors including high blood pressure, diabetes, high cholesterol, a family history of heart disease, or a personal history of smoking, meaningfully raises the relevance and urgency of taking any combination of these symptoms seriously, rather than assuming they reflect a more benign, everyday cause. Let's talk specifically about why women in particular are more likely to experience these atypical presentations rather than the classic chest pain narrative most commonly discussed. Research on heart attack presentation differences between men and women has consistently found that women are statistically more likely to experience fatigue, shortness of breath, and nausea as prominent symptoms, sometimes without significant chest pain at all, compared to men who more frequently experience the classic, centrally located chest pain pattern. This difference has genuine, serious consequences, since women experiencing these atypical symptoms are sometimes diagnosed later, or their symptoms are initially attributed to less urgent causes, delaying the emergency care that can make a meaningful difference in outcomes. Let's also talk specifically about diabetes and its connection to atypical heart attack presentation, since this represents another genuinely important population worth understanding in detail given how common diabetes becomes after 50. Diabetes can damage nerves over time, a condition called diabetic neuropathy, discussed in other conversations regarding its connection to sensations in the hands and feet. This same nerve damage can also affect the nerves responsible for transmitting pain signals from the heart, meaning some people with diabetes experience what's called a silent heart attack, one with minimal or no chest pain at all, presenting instead through some combination of the other, less classic symptoms discussed throughout today's video, or in some cases, with remarkably few noticeable symptoms until the event has already caused significant damage. Now let's build a simple, practical framework for how to respond to these signs, since recognizing them is only valuable if paired with clear, appropriate action. First, if you experience any single symptom from today's list suddenly and without an obvious explanation, pay close attention to whether it's accompanied by any other symptoms from the list, since this combination significantly increases the concern level. Second, if you have known cardiovascular risk factors including high blood pressure, diabetes, high cholesterol, a family history of heart disease, or a smoking history, treat any combination of these symptoms with heightened seriousness and a lower threshold for seeking emergency care, rather than waiting to see if things improve on their own. Third, and this is genuinely the most important point in today's entire video, if you suspect you or someone else might be experiencing a heart attack, call emergency services immediately rather than driving yourself to the hospital, waiting to see if symptoms pass, or trying to confirm your suspicion through further research or discussion first. Fourth, don't let embarrassment about a potential false alarm prevent you from seeking care, since emergency medical professionals genuinely would rather evaluate and rule out a cardiac event than have someone delay care for a genuine emergency out of concern about being wrong. Fifth, if you're uncertain whether a symptom warrants an emergency call versus a routine doctor's visit, err on the side of the emergency call specifically when the symptom is sudden, severe, or combined with other signs from today's list. Since time genuinely matters significantly in cardiac emergencies, and emergency evaluation can rule out a cardiac cause more quickly and thoroughly than waiting for a routine appointment. Let's talk a bit more about why time matters so significantly in a genuine cardiac event, since understanding this urgency helps clarify why immediate action, rather than waiting or self-monitoring, is so consistently emphasized by medical professionals. During a heart attack, blood flow to a portion of the heart muscle is blocked, and heart muscle tissue begins to be damaged the longer that blockage continues. Emergency treatments, including procedures to restore blood flow, are considerably more effective the sooner they're administered after symptom onset, meaning every additional hour, or even every additional set of minutes, spent delaying care can translate into meaningfully more heart muscle damage and correspondingly worse long-term outcomes, which is precisely why medical guidance consistently emphasizes calling emergency services immediately rather than waiting to see if symptoms improve. It's also worth addressing what to expect if you do call emergency services for symptoms that turn out not to be a heart attack, since this genuinely common outcome shouldn't discourage anyone from seeking care when symptoms warrant it. Emergency medical professionals are specifically trained to evaluate exactly these kinds of ambiguous, potentially cardiac-related symptoms, and a visit that concludes with a non-cardiac diagnosis represents the system working exactly as intended, appropriately ruling out a serious concern, rather than representing a failure or an overreaction on your part for having sought care in the first place. Let's talk briefly about a specific piece of guidance you may have heard regarding aspirin during a suspected heart attack, since this is worth understanding accurately rather than acting on based on general assumption alone. Some emergency protocols do involve chewing a standard aspirin while waiting for emergency medical help to arrive, since aspirin can help reduce blood clotting during an active cardiac event. However, this guidance comes with genuine caveats, including that you shouldn't take aspirin if you have a known allergy to it, a bleeding disorder, or have been specifically told by your doctor not to take aspirin for another medical reason. The safest, most appropriate approach is to call emergency services first and follow the specific guidance the dispatcher provides regarding aspirin, rather than taking it automatically before making that call, or without knowing whether it's appropriate for your specific situation, since dispatchers are trained to provide this guidance based on your particular circumstances in real time. It's also worth addressing symptom duration and pattern specifically, since this can help distinguish a genuine cardiac emergency from a less urgent, though still worth mentioning to your doctor, related condition called angina, which involves chest discomfort caused by temporarily reduced blood flow to the heart, often during exertion, that typically resolves within a few minutes of rest. Symptoms that persist beyond several minutes, that occur even at rest without any clear triggering activity, or that come with any of the other 6 signs discussed throughout today's video, should be treated with the same urgency as more classic heart attack symptoms, since distinguishing between these possibilities in the moment isn't something you should attempt to do yourself. This distinction is precisely why emergency medical evaluation matters, allowing trained professionals to make this determination through appropriate testing, rather than someone experiencing these symptoms trying to reason through whether their particular pattern is serious enough to warrant a call. Let's also briefly address why calling emergency services specifically, rather than having someone drive you to the hospital yourself, matters so significantly in this particular situation. Emergency medical responders can begin appropriate treatment and monitoring the moment they arrive, sometimes administering medication or beginning other interventions before you even reach the hospital, time that would otherwise be lost during a car ride. Additionally, if your condition worsens during transport, including the possibility of your heart's rhythm becoming dangerously abnormal, emergency responders have both the training and equipment to respond immediately, capabilities a family member driving you to the hospital simply wouldn't have available. This is precisely why medical guidance so consistently and specifically emphasizes calling for emergency transport rather than arranging your own transportation, even when a hospital might seem relatively close by. Let's also mention something worth knowing about heart attacks that are only discovered later, sometimes called silent heart attacks in medical literature, referring to cardiac events identified afterward through an EKG or other testing, in someone who experienced minimal or no noticeable symptoms at the time the event actually occurred. This phenomenon, while somewhat different from the missed but present symptoms discussed as the primary focus of today's video, underscores a related, important point that regular checkups, including appropriate cardiovascular screening as recommended by your doctor based on your individual risk factors, provide an additional layer of protection beyond symptom recognition alone, since some cardiac events genuinely do occur with symptoms subtle enough that even careful, informed attention might not catch them in the moment, making these regular screenings a genuinely important complement to the symptom awareness discussed throughout today's video. What if you have a symptom that's been present in a pattern that's been consistent for months or years, without any of the acute, sudden qualities discussed throughout today's video? A chronic, long-standing pattern of mild fatigue or occasional indigestion, for example, that hasn't changed recently and isn't accompanied by other concerning signs, is genuinely different from the sudden, new, or worsening presentation discussed as the primary concern throughout today's video. However, any chronic symptom pattern is still worth discussing with your doctor at a regular appointment, since it may reflect an underlying condition worth evaluating, even if it doesn't necessarily represent an acute emergency requiring immediate action. And what about people who aren't sure whether what they're experiencing matches the descriptions in today's video closely enough to warrant concern? This uncertainty itself is worth taking seriously rather than dismissing, since medical professionals specifically want people to err towards seeking evaluation when genuinely uncertain, rather than trying to definitively self-diagnose based on a general educational video before deciding whether to seek help. If you find yourself uncertain and genuinely worried about your symptoms, that worry itself is a reasonable basis for seeking prompt medical evaluation, whether through emergency services for acute, concerning symptoms, or an urgent conversation with your doctor for symptoms that feel concerning but less acutely severe. Let's also talk specifically about recognizing these signs in someone else, since this often requires a different kind of attentiveness than noticing them in yourself. Someone experiencing a cardiac event, particularly with atypical symptoms like unusual fatigue or unexplained anxiety, may not recognize the seriousness of what they're experiencing, sometimes insisting they're fine or that it's nothing to worry about, even as they display concerning signs like sudden paleness, sweating, or an inability to continue a normal conversation or activity. If you notice someone displaying a combination of these signs, particularly if they seem to be minimizing or dismissing what's happening, it's appropriate to advocate for seeking emergency help even if the person themselves is initially reluctant, since the person experiencing these symptoms isn't always in the best position to accurately judge their own situation in the moment. It's also worth briefly distinguishing heart attack symptoms from stroke symptoms, since both represent genuine medical emergencies requiring immediate action, but with somewhat different typical presentations worth understanding separately. Stroke symptoms classically involve sudden facial drooping, arm weakness on one side, and slurred or difficult speech, often remembered through the acronym FAST, which also stands for the importance of noting the time symptoms began and acting fast to seek help. While heart attack and stroke are distinct medical events with different underlying causes, both require the same fundamental response: immediate emergency care rather than waiting or attempting to manage the situation independently, and both can sometimes present with overlapping symptoms like sudden dizziness or confusion, meaning any sudden, unexplained combination of concerning symptoms warrants the same urgent, immediate response regardless of which specific condition ultimately turns out to be occurring. Let's also address the relationship between symptom recognition and cardiovascular risk reduction more broadly, since recognizing these signs works alongside, rather than instead of, the broader cardiovascular risk reduction discussed in other conversations. Managing blood pressure, maintaining healthy cholesterol levels, not smoking, staying physically active through practices like the walking and stair climbing discussed in other conversations, and managing blood sugar if you have diabetes, all meaningfully reduce your underlying risk of experiencing a cardiac event in the first place, working alongside the symptom recognition discussed throughout today's video as complementary components of a comprehensive approach to cardiovascular health after 50. Let's also mention the value of knowing your own personal risk factors specifically, since this information genuinely shapes how seriously you should treat any of the 7 signs discussed today. If you don't currently know your blood pressure, cholesterol levels, or blood sugar status, scheduling an appointment with your doctor to establish this baseline information provides genuinely valuable, individualized context, helping you understand your own personal risk level and, by extension, how seriously to treat any of today's 7 warning signs should they ever appear in your own experience. Now let's summarize everything in a simple way. 7 commonly missed heart attack warning signs include unusual, disproportionate fatigue, shortness of breath without accompanying chest pain, discomfort in the jaw, neck, or upper back rather than the chest itself, nausea or indigestion-like sensations, unexplained cold sweats, sudden lightheadedness or dizziness, and an overwhelming, unexplained sense of anxiety or impending doom. These atypical presentations are particularly common in women and in people managing diabetes, populations where the classic chest pain narrative is considerably less reliable as the primary warning sign. Any of these symptoms appearing suddenly, occurring in combination with each other, or appearing in someone with known cardiovascular risk factors, warrants immediate emergency medical attention rather than waiting to see if symptoms pass or attempting to self-diagnose through further research. But remember, the goal of today's video isn't to create anxiety around every ache, tired day, or moment of stomach discomfort you experience. It's to help you recognize a genuine, evidence-based pattern of warning signs, so that if you or someone you love ever experiences this combination of sudden, concerning symptoms, you'll know to act quickly and seek emergency care immediately, rather than dismissing these signs the way so many people unfortunately do. So today, take a moment to genuinely familiarize yourself with these 7 signs, perhaps sharing this information with a spouse, family member, or close friend, since recognizing these signs in someone else can be just as life-saving as recognizing them in yourself, particularly given how symptoms like unexplained anxiety or sudden fatigue might not immediately seem alarming enough for the person experiencing them to seek help on their own. Now, I want to hear from you. Were you already aware of these 7 atypical signs? Or did any of them genuinely surprise you? Share your thoughts in the comments below, and consider sharing this video directly with someone in your life who should know this information, since it may genuinely help them recognize a serious situation more quickly than they otherwise would have. If this video helped you, please like, subscribe to Nutri, and turn on notifications so you don't miss more important health information for adults over 50. And next, watch our video on what happens to your heart when you climb stairs daily, because understanding both the warning signs to watch for and the practical, everyday habits that support genuine cardiovascular health gives you a more complete picture of caring for your heart at this stage of life.